Hi, this is Dr. Chris Snyder from Peninsula Regional Medical System. Just kind of updating the community on what's been happening with COVID. Hospital's been obviously very busy and having a fairly large influx at this point in time. And not a huge surge, but we're seeing day-to-day increases in volumes and filling up our medical units pretty quickly. We're having a fair amount of intubated patients and the very sick, and we're also getting a lot of folks out of here too, which is very exciting. And most of the elements of treatment are limited because this is a virus and a lot of the country doesn't know how to treat this yet. But the exciting news is that we are sending folks out of here every day. A lot of the questions I get on a regular basis is how long is this going to last for? And really, I'm not quite sure. I think we're finding that a lot of these patients after hospitalization have a lot of requirements for respiratory problems. Those are things that are going to be ongoing, and we'll continue to manage those. But there are some challenges. We're not sure what the outcomes of these folks are going to be, whether they're young individuals or they're elderly, and how we manage them with oxygen or not oxygen. So there'll be some challenges with that as we move forward. There'll also be a number of different challenges with the, again, the more compromised patients that are coming out of our COVID unit and going to next level of care providers. For example, like Anchorage, who has been really partnering with us to take our COVID patients after hospitalization. They have a unit there specifically for COVID patients, which has been a wonderful addition to our transitions for some folks out of the hospital. So a number of different patients going there. We have other facilities, acute rehab centers like Encompass, who has been very helpful in taking some of our non-COVID population because I don't think people realize we have a whole building full of COVID or COVID risk patients in the Layfield Tower. And then we have this other population called the usual patients, and we're taking care of them in the other part of the hospital. So they need their acute and subacute care post-hospital, and those things are really important. As far as things you can avoid with being around COVID patients or being around COVID population as they leave the hospital, we have specific quarantines. The CDC website is grade 1 cdc.gov to help kind of guide you, but ultimately calling your healthcare provider to get the best possible advice you can is super important. Again, when you're social distancing and you're out there in the community, I think it's extremely important that we maintain that 6 foot. And people wonder why it's 6 foot. I always try to explain to them 6 foot means nothing more than in a conversation you don't want to be right on top of each other. 6 foot's just a good emphasis of distance, which we all need to have right now. If you're sneezing or coughing, I do warn that is accelerated form of aerosolizing any virus. So it's important that you cover up, and if you do, please turn your head. Let's not share with everybody. It's one thing we don't want to share at this point in time. Hand hygiene has always been an emphasis, and if you've heard me talk in the community, it's always been one of the things that we focused on. Healthcare for years has had standards around hand hygiene and around how we foam in and foam out of rooms. We get monitored for that by the state and also by Joint Commission. So those things are really important, but now even more important is that the rest of the community is also doing that. And I don't think you can be excessive enough with washing your hands at this point. You got to remember, people who are wearing gloves out there, it's important to understand that your gloves are just as dirty as what your hands touch. So gloves aren't really effective with this. This virus doesn't get absorbed through the skin. This virus comes from typically you taking your hand, touching something, and touching your the 5 entries through the head, your eyes, your nose, or your mouth. So those areas are really huge emphasis for why you have to wash those hands, and make sure you're singing happy birthday while you do it too, because getting that good 20-second scrub, that friction really does make a big difference with hand hygiene. And as I said before, hot soap and water is all you need. You don't need to go out and bleach your hands. Hot soap and water is plenty to kill this virus. This virus is very contagious, but it also is easy to kill if you wash it down the drain. So it's important to understand that as we're moving forward. Um, so as we move into this process where we're sending people out of the hospital and back to our loved ones at home or our facilities to manage them in the outpatient, there'll be a lot of evolution of how we deal with this, how we quarantine, for how long or how short, whether we'll be testing more or not. And we are spending a large portion of our time developing testing protocols for this. We are learning. I ask for one really, really important message to go to the community is e-patient. This is really very difficult for us. We've never seen anything like this before. We're learning every minute something new. We've obviously invested the effort in the hospital by developing a COVID hospital within our hospital. And it's important, I think, for everybody to understand that as we move into the next stage of this rising pandemic, we need to all work together and focus on understanding that we're not perfect with this. We're definitely learning, and we are making mistakes that we are trying to learn from every hour of every day. At this point in time, hopefully we'll be able to do this weekly with you, and I'll be back on next week to give you another update with how things are going with our pandemic event in the Lower Shore. Thank you.